The following is paid programming.
It's time to talk taxes.
New friends, new opportunities, new partners. EG Tax.
It's Ask the Tax Lady with Esther Gulius and EG Tax on News Radio 930 WBEN. To reach Esther now, call 803-0930. Toll free at 1-800-616-9236. And cell calls are free at star 930. And now, live from the WBEN studios, it's Esther Gulius.
Hey, everybody. This is the Tax Lady, and this is our hour to keep you abreast at what's happening in the world of finance and taxes. And just like per normal, we're going to give you information that you're not going to get anyplace else, and that's one of the things we strive to do on our radio show. And, of course, I'm wishing you all a happy Memorial Day. I'm hoping that it'll be a great day on Monday and this whole weekend. And I just am so thankful for the people that have stood up for our country. I'm thankful that we had soldiers and first responders and people that gave their life, and I'm thankful to be an American. So, and I'm joined in studio with Tiffany Fabian. Hey, Tiff.
Hey there, Esther. Happy Saturday.
Happy Saturday, and Christopher Fabian.
Hello, Esther.
Hello, Christopher. Okay, so before we get to our special guest, who I'm going to tell you, if you've had health, if you're wondering about health insurance and you're wondering if you can qualify and you're wondering about all the loopholes, our special guest, as we have a couple things we want to talk about first, but as our show unfolds, is going to be Brian Faraci from the Financial Guys Health Network, and he's in studio and he's going to give you all kinds of tips on what to do if you don't have health insurance, or maybe you have health insurance so there's a better option for you. And so get your questions ready, 8030930, 8030930, star 930 on your cell phone. We're going to be with Brian in a moment, but I want to make sure before we get off the subject of taxes completely, although taxes and health insurance kind of go together, because if you get too much of a subsidy from New York State of Health, when you get your taxes done, we make you pay it back. So there's definitely a correlation, and that's what Brian's going to help us with too. But there's a couple things we want, some kind of housekeeping items here we want to make sure you're aware of. If you're somebody that's gotten unemployment due to the pandemic, or even if you're collecting unemployment the last couple of years, and in the last month, week, or what's coming up, you may be getting a letter from New York State asking you to support how you were eligible for that unemployment, and we wanted to talk about that for a minute. Chris, Tiff, you want to address that?
Sure. Right now, New York State Department of Labor is mailing out letters to people to say, hey, we now need proof that you qualified for unemployment during 2020 and 2021. So you need to send us, if you were an employee, your W-2 for 2019. If you're self-employed, you need to send us your 1099s, your receipts, your invoices. They want proof you actually had a business in 2019. And if you ignore it,
then you're going to pay it back.
You're going to pay it back plus penalty and interest.
And that's, wasn't it mind-blowing to you that people were getting unemployment so easily? And I'm thinking, gee, did the state of New York turn over a new leaf? But now the state of New York is saying to the people, okay, you got it. Now prove to us that you deserved it. And so that's part of what EG Tax will help you with. We will help you to put together the information to substantiate the claim. And I'm going to tell you, if there is nothing to substantiate, if it was just kind of we're going to try and see if we get the money, and you got the money, be prepared to pay it back.
That's right. Yeah, regrettably. And so, it really just seemed like people were getting unemployment left and right. And so
people were getting unemployment left and right.
And the pandemic, you're like, okay. And so, but
yeah, for as many years as I've been a business owner, and I knew that my employees were collecting unemployment, I really was not intricately aware of what it would take for them to collect. I mean, all the ins and outs, but I knew that it wasn't easy to collect. And then all of a sudden during the pandemic, man, everybody was collecting.
Yeah.
And I saw some people getting $22,000 worth of income where they didn't have income like that the year before. So it'll be interesting. We will help you. If you're getting those letters, do not ignore them.
Yeah, and it was interesting to see. I mean, Chris, you had clients like this. They were retiring and they were getting $40,000 and they were riding into retirement. It was an interesting thing, and maybe they did qualify for it.
I mean, you look at these college kids, even high school kids that were collecting. Yeah. Total between the 2 years, $30,000 to $40,000 on a job that paid $500 a year to $4,000 a year.
So the whole thing is those letters are coming down the pike. You get that letter, you can go it on your own if you'd like, but we will help you to substantiate it. We understand what they're looking for, and if you want to give EG Tax a call, we will be very happy to help you. Don't ignore the letter.
Nope.
Amen.
All right, that's number one. And number two, before we get to Brian, is the if you're a business owner, you have a payroll, you might have been looking online or seeing that there is this new thing that they're talking about, this new credit that you can get on for your payroll, and that's called the Employee Retention Credit. Now, we talked about that for 2 years.
Yep.
Interestingly enough, I thought it was interesting that a lot of employers never stepped forward and talked about it. Well, now all of a sudden, it's these people that are experts at getting the credit are contacting business owners who have payroll and are saying, we can get you the money. And in some cases, it could be $80,000, $90,000, $100,000 because the credit can be up to, $26,000 per employee per year, right?
Right.
Something like that.
And the big thing is they changed the guidelines when it first came out. When
they first came out, if you had PPP money, they said you didn't qualify. But now, if you got PPP money and you suffered a decrease in business, and from what I understand, that's everybody did. I mean, we did. We had to rejig our offices and everything because of the pandemic. They're saying everybody just about would qualify. So if you're somebody that's being contacted by some of these people, they want 20% of what they get you.
Yep, and money down in order to do it.
And so we will help you with that too. We just wanted to make sure that people understood that.
Yeah,
right?
It's a lot of money on the table, and there's
and it's interesting. We talked about this when the tax laws changed. Nobody much stepped forward.
Nope, because
so it's good on one hand to see that these people are aggressively going after the small business owners to tell them it's available. It's always been available, and if you're now interested, we are not going to charge you 20% of what we get you. That's for sure. Our meat and potatoes is to be a cost-effective tax accountant.
Yep. And that's the thing, and I'm going to use this as a segue. Just as you just seen this change, we saw taxes change. Health insurance has changed drastically in the last 3 years, and it keeps changing. And New York State keeps extending Medicare on people that don't want it. They're like, too bad, you get it again. It's just crazy with what the government's been doing.
And that brings us into our special guest, Brian Faraci. Hey, Brian, thanks for coming and spending a Saturday with us.
Esther, thank you very much for having me on.
And Brian is a consummate health insurance expert. And so if we're going to take a short break, get your calls all lined up for Brian Faraci from the Financial Guys Health Insurance Network. He is the director. And 8030930, 8030930, star 930 on his cell phone. We'll be back on the other side with your calls.
Call too.
Talking health insurance. Hey, to us, your family, and that's what we try to keep you in the loop. Knowledge is power. When you just don't know something, you can't utilize it. It's interesting. A client of mine has a very professional daughter, works in the government, and something happened. She lost her job. And so with her job went her health insurance. And she ended up getting sick, and the family just didn't know what to do. She had to be hospitalized. And I said to the family, I said, well, first of all, she has no job. She's probably going to qualify for Medicaid. And they said, does that mean that her medical bills would be paid for? And I said, yes. And I talked to them the other day, and they said, lo and behold, it's exactly what happened. And they were flabbergasted because they were not, had they not asked the question, they would have ended up probably paying for the health for their daughter's recovery themselves. So that's part of what Brian offers, Brian Faraci. He's a health insurance expert, and just because people think they know, they really don't know, do they, Brian?
No, it's the system set up to be confusing, and it's not easy to even go through the application sometimes with some of the documents that they require for proof of income and proof of retirement. All that information is pretty well secure on their website as far as trying to get things done in a timely fashion.
Okay, so let's talk for a minute. Who would need? Who do you represent? Who is it that you help? I mean, is there are people that have health insurance, people that don't have health insurance, people that are low income? Who is your market?
Anyone that needs assistance with health insurance, and I think in this day and age with how confusing it is with co-insurances and deductibles and the subsidies you can get from New York State, I think everyone should be seeing some type of independent broker because we do represent all the insurance companies. So if you have Child Health Plus, we can assist you with that. If you're on Medicaid or the Essential Plan, we can also help with that. And if you have a gold, a silver, or bronze plan, we can help you navigate those plans as well.
So, like for instance, my client whose daughter had health insurance for the federal government, and then she lost her job. What is it that when somebody's out there struggling, has no insurance, and they think they can't afford it because maybe they don't have a job? Is that something that you would really help them with because they don't have any money or very little money?
Yeah, 100%. We would help them out in every aspect of it.
How could that be? I mean, explain how that could be.
Well, the way that New York State of Health looks at it is they're looking at your projected income for the year. So if you start out the year without having a job, you don't have any projected income. So your income would be zero. And if the state requires some kind of proof of that, we would just have to, show whatever proof they're requesting at that point. If you start out and you need insurance, if you lose your job halfway through the year and you need insurance, they're going to look at what you made previously and then again your projections. And if you have no projections, you're either going to get very low cost insurance, if not free. And worst case scenario, you'll get a subsidy discounted off of a gold or a silver plan if you choose.
Now, going back to Esther's client, if you do qualify for Medicaid, and you get on it, don't they go back like 6 months and pay those medical bills too or something like that, I believe?
Yes, there is an option to request to pay any past medical bills.
Jeez.
Wow.
So so if you're listening, and obviously this doesn't pertain to anybody that's over the age of 65, right?
The Medicaid aspect will, because you could still qualify for Medicaid and Medicare, and there are actually special plans for people that qualify for both.
Okay, so even if you're over 65, because of the Medicaid portion, because of income, right?
Correct.
So if you're sitting out there kind of scratching your head thinking, oh my gosh, I don't know how I'm going to pay for this, that's part of what you do.
And New York State just announced not too long ago that they've extended Medicaid and the Essential Plan without doing income checks all the way through this July, through the 31st.
So what does that mean? What does that mean?
So anyone that was locked in, or anyone that had the Essential Plan or they had Medicaid pre-pandemic, they've been locked in through the entire pandemic, and New York State continues to extend that. So at this point, it's been, if you were a July 1st renewal date, you've been automatically extended to July 1st of 2023. Now, what happens as of August 1st, we don't know yet, but it is, we do have the potential for millions of people in the United States to lose their Medicaid or their essential plans, which is, a scary thought because not everyone is back to work.
But right now, if they were on that special plan, they weren't paying anything, right?
Correct. So the essential plan was $20, and that was reduced down to nothing. And then Medicaid, as always, is premium free.
no charge.
Correct.
Now, going back to the Medicare, Medicaid situation for seniors, what's the income limit for somebody like that?
So that's actually a great question. Typically, it's right around just under $1,000 a month of income. But again, because of the pandemic, people were automatically grandfathered into their Medicaid even after the age of 65. And we're trying to tell people to take full advantage of that because some of these plans give out astronomical benefits that you're not getting with your normal Medicare Advantage plan.
Such as?
Actually, we're very limited on what we can say. Medicare has a lot of rules.
Okay.
So you can't go into plan details necessarily.
I mean, just be happy that you're on it.
Yes, of course.
Yeah,
Yeah,
he was just saying how everything they do has to go through compliance before he
Like
can
advertise.
air
Oh,
commercials or seminars.
Everything has to be educational purposes only because it's a government-ran program.
Right. Well, I mean, this is absolutely educational because you know what I see, and I know Tiff and Chris, and I'm sure you'd see it all the time. People don't know. I'm sure there's people listening thinking, "Oh, this is a bunch of hooey. This can't be true." I mean, they're not really going to give you free health insurance, but they do, right?
The nice thing about it is whether they want to believe it or not, sit down with me or give me a phone call, talk to me for a half hour, let me go through the details of the process with you. And worst case scenario, you decide to do it on your own. Either way, my services are free. Use me for my knowledge.
Yeah.
And so they call it 633-1331, right?
That's right at the financial guy's office, or they can call your office if they need
Right,
to.
or they
to
can
get a
call
hold
our
of me.
office and you can get a hold of us through our website at egtax.com. Our corporate phone number is 632-7886. And I'm going to tell you something. We got involved with health insurance because during Obamacare, we were the bearer of bad news, and we would have to tell people that they don't have insurance, they're going to get penalized, and part of the tax return was the penalty. So we got involved in health insurance, and so we have carried forward that service. And I will tell you, if you don't have health insurance and you think you can't afford health insurance, you have to call Brian,
And then-
because you would be surprised at what's available.
Brian and Esther, I have a family of 5, and they make around $65,000-$70,000 a year, and their 3 kids. Now, Brian, you will have to educate on this. I told them to pull off their kids and go on Healthy New York, and that could really, because the health insurance that he was working for a car dealer, was just strangleholding them through his employer. And so pulling off the kids is a good option, isn't it?
Yeah, I actually do it with my family. My my wife and I are on the insurance plan at work, and my kids have Child Health Plus because number 1, I'm saving my company money, and number 2, I'm saving myself money because Child Health Plus doesn't have any co-pays or deductibles or anything that you have to meet like you would on a work plan.
Right.
So explain exactly, what does that mean? What happened? What do you mean pull off your children?
So if in Tiffany's case that she's speaking of, so you have the adults that would stay on the work plan, and they would reduce their plan from a family plan, which is typically full price, about $1,800 a month. So you'd reduce that to a spouse plan, so remove about $600 off the premium. Now you're saving your employer that every single month. And then you can put your kids on Child Health Plus, and you could be paying as low as nothing, $15 a month, $45 a month, and it's based off the household size and income. So again, you're saving your company money, which you can use that to negotiate raises and other things in that fashion.
And that Child Health Plus, does that include dental?
You're going to include all dental, vision, and you're going to have no deductibles, no co-pays when you go to use the services. Quick story, both of my daughters broke their arm 2 summers ago, less than a week apart.
No.
And thankfully they were on Child Health Plus because we didn't have any out-of-pocket cost.
Wow. What were you going to say, Chris?
I was going to say, now, we all know that you can cover your children up to age 26. You don't have to,
Yeah,
right?
correct.
So, if mine and Tiff's daughter just graduated college, we could pretty much have her talk to you to see what it would be for her out on her own with her income, and then see through our insurance if it's cheaper if there is a spousal plan.
As long as she's not filed on your tax return as a dependent, and as long as she's, if she's just making that transition into the working world, she's probably not making a ton of money, so she'd qualify for, a ton of discounts most likely.
Okay, something to think about there.
Very good. The light bulb just went off.
And here's the thing. It's like anything you hear, it can be a good idea. If you do nothing about it, you should have, it was like it was a waste of air. Because if you don't change what you're doing, you're going to continue to get what you got.
Right.
And so just picking up the phone on Tuesday morning after Memorial Day and giving Brian a call and sitting down with him and seeing if there is anything available. And I'm going to tell you what, I don't care what you've heard over the fence. I mean, remember when they'd say you don't qualify for Medicare or Medicaid if you have a house? Is that true, Brian?
That is not true. That's based off of
if you
household
have a
size
home and
income.
you have assets, but you have no income coming in, could you qualify for Medicaid?
Sure can. Yep. Absolutely.
See, and that's what people don't understand that.
Yep. And I know I have a lot of clients that do their retirement planning based upon the health insurance and keeping their income low to get Medicare or the essential plan. But we can talk more about that.
I know we got a break for the news. I'm Esther Gillies, the tax lady. 8030930, 8030930. We'll see you on the other side. Hey, to us, your family, and part of the family is to keep you abreast of what's going on. And we have special guest today, Brian Faraci from the Financial Guys Healthcare Network. And I will tell you, there are things in the New York State of Health, and under and Brian, like he said, represents all these health insurance companies that are available to you. I know it's so easy to say, I don't want to change. I had one client that's been paying years and years. They've been retired for a number of years, and they pay like $20,000 a year in health insurance over and above their Medicare because they're afraid to explore a supplemental plan because they think they're going to be canceled. Is that something people have to worry about, Brian, is getting canceled?
In some circumstances, depending on where you work, if they offer a retirement plan over the age of 65, like a state or a federal employee, once you leave the plan, you're most likely cannot go back onto the plan. There's things that are
But the
written in
question is,
contract.
can you be canceled? If you change insurance companies and you had a pre-existing condition, can you be canceled?
Not in New York State. New York State's one of 3 or 4 states where there's no
So
pre-existing conditions.
you cannot be canceled for a pre-existing condition.
Correct.
I mean, that's so important because this lovely couple paying $20,000 extra a year, the reason they do is because they're afraid of getting canceled.
No, so depending on their health circumstances, we would put them either into a Medicare Advantage or a Medigap plan. And again, there's no pre-existing condition clauses, no medical underwriting, none of that applies in New York State.
Okay, and something like that would cost how much a month?
Medicare Advantage plans actually cost as low as $0 a month. They have premium-free
So they would
plans.
only save $20,000 a year.
Yeah,
right?
just a little bit.
And see, it's fear, and it's not knowing and fear coupled together that stops people from moving forward.
Yeah, that's exactly right. Plus, people think that brokers are there just to make a quick buck and move on, but it's different in a healthcare situation because we're not making money off of you particularly. We're making it the insurance carriers paying us, and it's a flat amount. So just because you buy a $200 plan doesn't mean that I get paid more money.
Right, absolutely. All right, why don't we go to the text that's been waiting? Well, of course, a text is a text.
Yeah. It says, Brian in team, up to what age can my kids be included on my health insurance through my employer?
The age would be 26. You're able to keep your kids on there.
Which
But,
is nice
but they don't
for
have
young
to
kids.
be.
They do not have to be. And again, if they're working part-time or they don't have a ton of income, let's explore the option of the essential plan or even Medicaid to get discounted insurance and reduce the cost of copays.
Absolutely.
And that's what Tiff, you and Chris went ding 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 ding. right?
Yeah, because we haven't been claiming our daughter for a few years, and so
And
ding,
here
ding,
you
ding,
are,
ding.
the cobbler with holes in his shoes.
Yeah,
Right? I mean, because here you are surrounded by Brian,
Knowledge.
and you never thought of asking.
right. And until this moment,
And
yeah.
so you better nail him before he leaves.
Oh, he
and
already
say-
said he's making calls when he leaves. So
Okay. And then what's our second text?
Our second text is, My mom just went into a nursing home, and we sold her house in 21. Should we have included that sale on her return? And so,
Yes, if the house was still in mom's name, it would have been mom that sold the house.
right. And so, unless she made, if she wasn't married, less than 250, it didn't have to be included. If she was married, less than $500,000 on gain, it wouldn't have to be
And
included.
so the bottom line is she wouldn't pay taxes if she were a widow.
Right.
She wouldn't pay taxes unless the gain was over 250 or 500 if she was filing a joint return. So as long as the house was in her name, yes, it should have been on the return, but it would have been tax free.
Correct.
Right?
That's right. If
Okay.
the details were different, let us know.
I'm Esther Gullius, the tax lady, with Brian Faraci. He is a health insurance expert. He will help you if you have any health insurance questions, or of course, if you this is our tax time. You can also call and ask a tax question. 8030930, 8030930, star 930 on a cell phone. Unemployment. Don't forget what we talked about at the beginning of the show, and the employee retention credit. Those are big things. And we have Brian Faraci here, full show here. So 8030930, 8030930, star 930 on a cell phone. And we have Carol from Wheatfield. Hi, Carol.
Hi. I was wondering about taking the children off and putting them on Child Health Plus.
Okay.
Can that only be done once a year?
Good question. We asked the same thing.
So there could be a stipulation that you may have to worry about with your employer's insurance. But you can either, if you contact the office and set up an appointment, I can do a conference call with you with your employer because I'll know what questions to ask, or if you do it on your own and relay that information, because if we can drop your kids off, then we can explore the option of Child Health Plus.
Yeah, Brian mentioned like a life event, like our daughter graduating from college.
Correct. Yeah.
And so a life event was part of the stipulation, Carol.
Sometimes the employer will allow you just to drop off your kids or anyone off the policy. Because, again, you're saving them money, so I don't see why they wouldn't want you to or allow you to.
Okay. Very good. Thank you.
Good
All right.
question.
Thanks a lot, Carol.
Thank you.
Esther Gullius, the tax lady, 8030930, 8030930, star 930 on a cell phone. You can text us at 716-8030930. We're talking unemployment. We're talking employee retention credit. And more than anything, we're talking to Brian Faraci about health insurance. He's a health insurance expert. And believe it or not, health insurance does not have to be a gigantic burden. And a lot of times, especially people they've been around the block a few times, they think about the way things used to be. But the way things used to be is not how it is right now.
It's
right?
like night and day with health insurance from what it used to be. I remember growing up, and every time I went to the doctor when I was a kid, it was like $5. Go to the dentist, it's a $5 copay. Nothing. My dad barely paid anything for the health insurance plan for a family, and now it's you need an arm, a leg, and your firstborn to pay for health insurance.
It's astronomical.
All right, why don't we go back to the phones? We have Cindy from Tonawanda. Hi, Cindy.
Hi, how are you?
Good.
I am retiring at the end of June. I will need health insurance. My husband had been on my health insurance, but he is over 65, so I assume, would need to go to Medicare. I was just wondering, I've been looking at the Marketplace website, and it seems to me that with his Social Security and my income that I'm still going to be paying $400 to $500 a month with a $6,000 to $8,000 deductible before anything kicks in. Do we get any credit for the amount he will have to pay to be on Medicare?
So they're going to look at if it's just the both of you, they're going to look at a household of two with one person needing health insurance, and then they're going to look at whatever you guys have made from January 1st up until the end of June, and then a projection of what you and your husband are going to make for the remainder of the year. And based off whatever those end numbers are would, determine what the subsidy or discount that you would get off a plan for yourself.
Okay.
So without having actual numbers in front of me, there's...
Well, let's use some projected numbers. I mean, Cindy, what do you think your income will be for the second half of the year?
Well, total for the year, because I'll still have my income for the first 6 months, is probably going to be $68,000 to $70,000. So for the first 6 months, it looks to me like I'm going to be paying $400 to $500 a month for health.
So is 32,000 going to be from July to December?
It'll be 68 total for the whole year.
Is that including your husband's Social Security as well?
That's what it looks like they look at, is the whole year, not just the last 6 months.
Correct. So they look at exactly what you made to date, and then they project out whatever you're going to make after that. So they're not looking at just the first 6 months of your husband's Social Security. They're looking at the 6-month projection for the end of the year as well.
Correct. And then it would have to be redone at the end of the year for next year's, which would get me a little bit of a subsidy, but it still doesn't seem to be that much.
Yeah, it's a tough situation that you're in with the income that you have, is that you're right over that income limit for getting discounts. I think if off the top of my head, you may get maybe a $25 or $30 discount a month with the income that you currently have.
Now, if she were to load up 2 IRAs and eliminate $14,000 worth of income, is that enough? Is that enough to bring her down to get a preferential cost?
Depending on Cindy's health situation, if she's not going to the doctor a lot, there's a couple different things. We can go into a bronze plan or some kind of health savings qualified plan, and we can sock some other money away that way. That can be used for medical bills in the future. Or put it into an IRA, but it really depends on what her usage is for medical services, if it makes sense or not.
But
So, Chris, you know what I'm saying, right?
So because it all goes by the AGI for the subsidy.
Yep.
So if they put money into an IRA, it lowers their AGI, which it was 68. Now it will say it would be 54. So how much more of a subsidy would she get at $54,000 compared to 68, roughly?
Even if it was a couple $100, it may not be worth it, because if Cindy's not going to the doctor and not using any medical services or very little throughout the year, you'd want to be in a lower level plan that's cheap rather than putting money away in an IRA.
Right, but it all depends on your medical needs. Your best
And then
bet would
could
be,
she, over and above that, do an HSA?
Yes, she can. And
So
at her
that
age, I
also
believe,
knocks it down
yeah, as a married couple,
another 7,000, right?
Yeah, as a married couple, I think it's going to be like 80,
So now she's under
8,400 this year.
under 50.
Yep.
yes, if you have the money. Your best bet.
Of course, we're spending Cindy's money for her. But what I'm trying to guess, I guess I'm trying to get people to understand is, when you're retired, your income is lower, and so you can utilize some of these things like a health savings account, which is a tax deduction, and IRAs, which are tax deduction, bringing your adjusted gross income down.
Yes. It's absolutely a great option, and it's going to depend on each person's individual circumstance.
Sure.
And you are saying, Cindy?
I don't use many doctors, but I do see that some plans, they say they are not eligible for health savings account. Can I set one of those up outside of the plan?
So you do set it up outside of the plan, but it has to be an HSAQ qualified. It has to say HSAQ on it, and there should be 2 bronze plans, or actually more than 2 bronze plans, and a handful of silver plans as well.
Isn't that like a $1,500 deductible for a single?
No, the deductibles on those are much higher. You're looking at probably $6,000, $8,000, like Cindy was saying.
Oh,
Okay.
I
if
thought
you're
for
not
an
using-
HSA
Boy,
qualified.
Cindy, you better stay healthy for the next few years.
Well, it's so funny. Talking to my clients, this is one of the reasons they wait to retire, because of health insurance costs and making that that maneuver and doing it. And
But I guess the point I want to make is, because of the deductibility of IRAs and the deductibility of HSAs, you can actually load up the HSAs and IRAs, and that kind of comes off your AGI, and that might help. You know,
Yes.
especially this would be especially true if she has some substantial medical
And that's exactly
expenses,
what I was just
right?
going to say, is if there's a lot of medical going on, then yes, you do want to load up and use that to her advantage to get
Right.
the discounts.
Okay, and then all right, so I guess we got to take a break. I'm Esther Gulius, the tax lady from EG Tax, 8030930, 8030930, star 930 on a cell phone. You can text us at 716-8030930, and we have our phone calls waiting, and we'll talk on the other side.
We are family. I got all my sisters with me.
Hey, family members, we're trying to keep you abreast of what's available to you. if ignorance is not bliss when it comes to taxes and insurance and money and what to do with stuff. I mean, it's an ever changing landscape, and we're thankful for Brian Faraci here, that's here from the Financial Guys Health Insurance Network, and we have Judy that's been waiting. Judy, thanks for waiting. How can we help you?
Hi, Esther. I have a question. I have a son who lives in another county in New York State, and he is on disability. He's 54, and he only gets like between $800 and $900 a month. His wife is a CNA, and he's having some terrible teeth problems. He has Medicare with the disability. Would he be eligible for Medicaid in New York State?
If they're filing taxes together, it's going to be based off household income.
So
What if they file separately?
And a certified nursing assistant doesn't make buku bucks
No.
generally.
Okay.
No, not at all.
So what if they filed separately?
That's a great question. If they file,
Because he would only have like $9,600 coming in from Social Security. That would be it.
yeah, so there'd be most likely a 2-year look back period. So if they, even if they started filing separately now, it's a 2-year wait period. So there's, so people aren't using those loopholes.
But if the wife doesn't, how much is the limit for a married couple with the wife?
Just under 18,000 roughly.
So
Does she make a lot?
No.
There are other programs though. There's the Medicare Savings Program.
Essential.
There's the Low Income Subsidy Program. There's a lot of other things. The EPIC program, but he's not going to be eligible for that until he's 65. But there are plans, Medicare Advantage plans, that work hand in hand with Medicare and Medicaid that do offer up to $3,000 in dental work.
Well, there you go,
So
Judy.
depending on what county he's in, I don't know. I'd have to look up the county to see what's offered in that area as far as the
Wayne.
maximum.
You're in
Wayne-
Wayne County.
Yes, there are actually 2 plans that I know of right off the top of my head.
So really, he should give you a buzz on Monday.
So you could
Yes.
call our office on Tuesday, or you could call Brian directly at the Financial Guys at 633-1331.
yeah, how long, Judy, has he been disabled?
I think about 4 years.
Okay, so then he should be on Medicare
Yeah,
now.
she stated that.
Oh,
yeah.
did she?
Yeah,
Okay.
he's
Yeah,
on
she
Medicare
did.
now.
Okay, I didn't hear that. Sorry.
But they don't have any extra money to go to the dentist.
Sure.
Yeah, so we would definitely want to take advantage of getting him into a plan as long as there's a special enrollment form right now. Worst case scenario, we have to wait to the fall during the open enrollment and switch. But either way, we can sit down and go through the details of everything and see what other programs he may be eligible for to get some relief on some of his cost.
Okay, Judy.
Okay.
Thanks.
What was
Thanks for calling.
Oh, the
she
phone
want-
number again.
It's
633-1331. 633-1331 is Brian's phone number.
Okay. All right.
Thank you.
And that leads us into a text that just came in. Could you talk about dental insurance for folks over 68?
Yeah, dental is a huge topic, especially in retirement, because the plan that you're used to having at work is, going to be fairly different, and usually your work plan is going to be better than what you can buy on the open market. But dental is not a quick fix. It's a long-term investment, kind of like you pay for your car insurance. You hope that you never have to use it, but you need to pay for it for the just in case, and that's how dental works. You'll still have deductibles and co-insurances, but don't plan on buying dental insurance and expecting it to fix all your problems in a couple of months, because most companies even have a 12-month waiting period where you can't actually use the insurance until the 12 months is up.
Is that because they think you'll use it
And
and
drop
then
it.
cancel?
And then cancel it. So
Right.
most companies, you can do your cleanings and x-rays within that 12 months, but there's not going to be any major dental that they're going to approve.
Right.
There are a few companies
And every time I
that
see a client that has about $25,000 in medical, I think, oh, you've been to the dentist, because dentists are not cheap,
No, not at all.
right? All right, let's go to line 2. We got Terry. Hey, Terry, how can we help you?
Hi, I am currently coming out of retirement and going back to work. I'll be starting back to work this coming Tuesday. I'm going to be working part-time, 24 hours a week, until I hit my full retirement age, which would be 66 and 4 months. So that would be probably sometime around September. Then I'm going to be working full-time, 10 hours a day, would be 40 hours a week, probably around $23 an hour.
Mm-hmm.
Currently on Social Security, I'm getting about $1,700 a month Social Security. I got a tiny pension. I'm on Medicare and Medicaid right now. I want to know what I can do to protect myself for the rest of this year and the years to come until I decide to go back into retirement.
So as far as the Medicaid goes, it's going to depend on when your renewal date is.
Right.
So let's pretend your renewal date's June 1st. Well, you're already locked into June 1st of 2023.
Well, my renewal date is January.
So as of right now, you're locked in until January of 2023 and nothing further unless the
Correct.
pandemic extends through then.
Right.
Depending on what your income goes to, again, there's other programs like we stated with Judy, the low-income subsidy and the Medicare Savings Program, the EPIC program. We can look into all those things for you and see where we can give you some kind of relief as far as out-of-pocket cost.
And again, using those IRAs and HSAs, they all help too to reduce that adjusted gross income.
I know I heard you talking about that a little bit earlier, and that just rang a bell in my head. So that's something else.
Yeah, I mean, because one of those things is that's very fluid. If you don't need it, you don't have to do it.
Yeah,
But
and
if you
then-
do need it, it's there.
Also, seniors qualify for earned income now. So for the
Right.
first year, if he starts working part of this year, his income is going to be low because he's not starting work until June.
No, he's working right now.
I thought he
part-time.
said
He's starting on Tuesday.
he's starting on Tuesday.
Working this coming Tuesday.
So I think.
Oh, okay. So prior to this, you haven't worked at all then, right?
Right, I haven't worked at all.
So I
Okay.
think he
All right, so
might.
Tiffany's right.
Possibly. Yep.
Possibly. You might qualify for earned income credit.
Right.
Which
And
is,
again,
And if he lowers his income
the
with
IRA,
the IRA.
and HSA is available to you, and you can put that in and help you with your earned income credit, help you with your health insurance. There's all kinds of things that you can do.
HSA is not available for people that are on Medicare Part A or Part B,
Oh,
which he
that's
would be
true.
on both.
That's true. Thank you. Okay, I'm Esther Galias, the tax lady from EG Tax, 8030930, 8030930, star 930 on a cell phone. Our text number is 716-8030930.
Oh, there's
So
a
Brian,
text
let's
that
do a
There's a text that just came in. I'm sorry.
Okay, that's
do
good.
I pay state income tax on my IRA when I take it out? Probably if they're under.
the first $20,000 that you receive in non-publicly funded pensions are going to be tax-free in the state of New York.
As long as you're 59 and a half.
Right.
Yeah,
once
New
you're
York
59.
State is kind to retirees. You get that $20,000 exclusion, unless it's a government or municipality, then it's all tax-free. And all of Social Security is tax-free on New York State. So New York
Right.
State is pretty kind to retirees.
Yep.
And Brian, I know last year, you would think as people age, they want to make things simpler. And we all know the health insurance made it more complicated because they went up to like 55 plans.
Yeah, there's 55, and that's just Medicare Advantage. That's not
Yeah.
including prescription plans or Medicare supplement plans.
When will you know the new plans for next year?
Probably within the next couple of months, within a month or two, but we can't release any information until October 1st. But we'll get all the highlights on them, though.
So it could go up. The more plans, they might be adding more plans, or they could be taking them away too.
Yeah,
right?
so typically you'll see them stay around the same average of plans each year. They're going to remove a couple plans. They'll add a new couple plans here and there.
And that texter who texted in about dental within the plans, there's dental and things like that. So each one.
Yeah, so most plans will come with your dental and vision. That's cleanings and x-rays, things like that. But if you're looking for any comprehensive dental or vision, you're going to want to look outside of Medicare most likely and buy an additional plan.
Yeah, and there's a caller coming in right now. Nope, this is not a caller. They're just saying what's the phone number of Brian.
All right. And again, Brian is 633-1331. It's Brian Faraci. So when you call the financial guy's office, ask for Brian Faraci.
And we also have Chris
Or you
Moody.
can call our office at 632-7886 and set up an appointment.
Yeah, we have Chris Moody that's working out of your office on Tuesdays and Thursdays if you need his help depending on which location, whatever's easier for you guys.
Good.
Colvin, Tonawanda, or Williamsville.
Yeah.
We got you covered, right?
Yep, everywhere.
All right. So, what words of wisdom would you give to our people, Brian, that are listening?
Just take a half hour, 45 minutes out of your day, have a conversation with someone from my team or myself, and at worst case scenario, you have peace of mind knowing that you're in the best possible
And
situation. for
if
your
you're
healthcare.
working for an employer and they're taking out and you're contributing more than 10% of your gross income to health insurance, you can leave that employer, can you not?
You can, yes, of course you can. You can leave the employer coverage and go with New York.
I mean,
State
you don't have
Health.
to quit your job. I mean, you don't have
insurance
to pick
coverage.
the employer's health insurance.
And I think
Because some people are paying a ton of money in health insurance.
And I think something important is you said just take a half hour. It's not just for somebody who's about ready to retire. It's for anybody. You know, like Chris
Right.
and I were sitting here thinking there's a solution for us too. It's for anybody.
I helped one of your clients the other day, and she said, well, my daughter has her own account on New York State Health. She doesn't need help, but can she assign you as a broker for a second set of eyes? I said, sure. Yeah, that's perfect.
Yeah. That's
So
the idea.
whether you're young or old, the financial
Well, I
death
mean,
insurance.
if you're alive and you need help with your health, right?
Yep.
I mean, it never hurts to learn something. Just like we talked about today with the unemployment. If you're getting unemployment letters, EG Tax will help. If you're a business owner and you're getting people that are saying, we can help you get the employer retention credit. We
For a lot of
told
money.
you about that for years. We can help you with that. We don't want 20% of what we save you, but there's the tens of thousands of dollars that are available to you. And if you need health insurance, maybe you don't think you need health insurance. You have health insurance. Maybe there's a better plan for you. Call Brian at 633-1331, 633-1331, or you can visit us through egtax.com, ask the tax lady, and we'll put you in contact with them because what you don't know really can hurt you. So are you going to be barbecuing this weekend, Brian?
I will all day tomorrow, all day Monday.
All right. Tiff and Chris, thank you for your help today. And for everybody that's listening, thank you so much. Have a wonderful Memorial Day. Pray for those poor people that lost loved ones both in Buffalo and in Texas. Thank you for listening. God bless you. Bye-bye.